Dental Hygiene 110, Unit Setup and Breakdown, Demonstration for Infection Control. Leslie Treadwell, First Year Clinic Coordinator and Assistant Professor. Utility gloves are now kept in the second drawer of your assigned unit. Wash glasses and perform proper hand hygiene. After completing hand hygiene, you're going to check your unit for inventory. With a clean paper towel, open all cabinets and drawers and check for any items that need to be replaced. If no items need to be replaced, continue on. If any items need to be stocked, fill out the inventory request form and do hand hygiene again. If any items need to be stocked, a second hand washing is required. Don PPEs. Anytime you touch anything sharp like needles or disinfectant chemicals, you have to wear utility gloves. After putting on utility gloves, before any disinfection, check the water bottle on your unit. If it needs to be filled, slowly unscrew it, trying not to touch the straw. Bring it to the sink of your unit, fill it up, and reattach. Then begin your soapy wipe. Before beginning the first soapy wipe down, with a clean paper towel, remove the disinfectant wipes from the cabinet. The first soapy wipe, you're going to use the soft soap dispenser, not the dispenser used to wash your hands. Begin disinfecting from the top down, beginning with the light. Nice, even strokes. Soapy water will remove any stains or debris left behind. This is not disinfection. If you drop a paper towel, do not pick it up. Get another one. Once something hits the floor, you have to push it away with your foot. You can't touch it. as with anything in dentistry. Nice, even, long strokes, no back and forth scrubbing. When picking up the individual hand pieces, be very gentle with the cords. They can come loose. The last cord is an intraoral camera. Be very mindful of getting that wet. Clean the cord and the attachment. Be mindful not to get water into the little holes. After the soapy wipe, get the disinfectant wipes and do the whole process again 2 times. Use enough cavity wipes to saturate it, but do not overuse them. It should take you 5 or 6 cavity wipes for the entire unit and cabinets. After disinfecting the unit, place a clean paper towel on your pull-out table. Bring your tackle box down. Disinfect the outside of the tackle box. Open it up and disinfect each item that you will need, placing the item on the shelf after you've disinfected it. Wash utility gloves. Take a disinfectant wipe. Wipe the utility gloves. As you can see here, she washes the utility gloves but does not take a disinfectant wipe to the gloves. Use a disinfectant wipe, wipe your utility gloves, then remove them, wrap them in paper towels, and place them on a paper towel in the second drawer of your unit. With a clean paper towel, open your cabinet, take out the items that you will need. From this cabinet, take out the over gloves. Put over gloves on so you can begin removing all the items you need from the cabinet. Take out your patient's bib. Take out your cuspidor. And the paper liner for the cuspidor. And a patient cup for disclosing solution. Take out 3 chair covers. A headrest cover, several syringe barriers, and the barrier tape. Open the drawer and remove high volume suction, slow volume suction, and 2 air water syringe tips. Attach the slow volume and the high volume suctions to the unit and turn it on. Take a cup and purge each water line for 2 minutes. You will do a 2-minute purge at the beginning of the day and at the end of the day. In between patients, you purge for 30 seconds. She's applying the barriers now. Anything that we may touch must have a barrier on it. The headrest cover needs to be attached to the side or the arm of your bracket tray. This is for hazardous waste only. Put the tape away using a clean paper towel. If this is left out during treatment, it will be considered contaminated and the whole roll will have to be thrown away. Make sure you put it back. After placing all barriers, perform hand hygiene. Lower the chair, push the bracket table back, raise the light, and have your chair ready to receive a patient. Take off your lab jacket, hang it on the hook at the back of your unit. And now you are ready to go and get your patient. After dismissing your patient, come back to your unit. Place your lab jacket on. Perform hand hygiene and don all PPEs. Don PPEs. Retrieve utility gloves. And you will now begin to break down the unit. After putting on utility gloves, you will take the large chair cover, turn it inside out, and use it as your receptacle for all other barriers you will remove. All barriers will go in the large chair cover except any biohazard that you may have in your biohazard bag. That gets disposed of in the biohazard receptacle. Throw away the paper liner inside the cuspidor and keep the cuspidor. Do not throw the cuspidor away. You will disinfect the cuspidor and then return it back to the cabinet of your unit. When you begin disinfecting, you do not need the soapy wipe on the breakdown. You will do disinfectant with your cavi wipes 2 times. After disinfecting all the lines, you will again attach your slow and high volume suction lines to the unit and purge both water lines for 2 minutes. Disinfect every item that belongs in your tackle box that you use during patient care that's on the shelf and place it back in your tackle box. Disinfect the entire tackle box when you're done and place it on the top of your unit. Wash the cuspidor with soap and water. Dry it. Disinfect it with a cavi wipe. Place it on the shelf. After your utility gloves are removed, you'll put the cuspidor back in the cabinet using a clean paper towel. Again, attach your slow and high volume suction lines to the unit and purge both water lines for 2 minutes. When your unit is completely disinfected, raise the chair to the most upright position, bring the light centered over the bracket tray, the computer gently off to the side, and the operator chair all the way back to the wall and on the right side.